Welcome to the Introduction to Medical Interpreting. I'm AnnaBelle, your training consultant, and I'll be guiding you through the key knowledge, skills, and abilities required to succeed as a medical interpreter. In this course, we'll cover the essentials. To begin, let's look at the knowledge, skills, and abilities that medical interpreters need. A medical interpreter must be fluent in English and their target language or languages, with strong reading and writing skills in both. They should be familiar with the policies, procedures, and protocols of medical centers. Medical interpreters require extensive knowledge of medical terminology, human anatomy and physiology, medical procedures, diseases, and pharmacology. Equally important are excellent oral communication skills and the ability to exercise sensitivity and patience in interactions with patients, families, and staff, especially in stressful situations. Maintaining confidentiality and awareness of cultural differences is essential. Medical interpreters also need a deep understanding of the Medical Interpreters Code of Ethics, Standards of Practice for Medical Interpreters and Health Insurance Portability and Accountability Act, HIPAA, as well as federal and state laws regulating the use of qualified and certified medical interpreters. They must have excellent memory, strong mental abilities, and a high level of emotional intelligence. Now let's explore the role of the medical interpreter. There are 4 roles for medical interpreters: Conduit, Message Clarifier, Cultural Broker, and Patient Advocate. Our main role is Conduit, and an interpreter is like a bridge between people who speak different languages. Your job is to pass along exactly what each person says so they can understand each other. Make sure not to omit, change, embellish, or add anything that is not said. When you interpret, always speak in first-person singular, just like the person talking. For example, if the patient says, "I need refills for my high blood pressure medicine," you should say in the other language, also known as the target language, "I need refills for my high blood pressure medicine." Do not say, "She said that she needs refills for her high blood pressure medicine." The second role of the medical interpreters is as a message clarifier. In addition to conveying information accurately, the interpreter clarifies meaning when necessary, serves as a cultural broker when cultural practices affect understanding, and advocates for the patient when appropriate. As a medical interpreter, you may encounter situations where simple interpretation is not enough to ensure understanding. Clarifying is part of your role. For example, you might say, "This is the interpreter speaking, would you please repeat that?" Or, "I apologize, doctor, but the interpreter is not familiar with the term arthroscopic surgery. Would you mind explaining that term to me?" Another important function is acting as a cultural broker. This is the third role of the medical interpreters. When interpreting alone does not fully facilitate communication, medical interpreters have both the flexibility and the obligation to step in and address cultural issues. Always make the provider aware of the cultural issue you've identified. Medical interpreters may also serve as advocates. This is the fourth and last role of the medical interpreters. In some settings, this can mean showing patients around the hospital, guiding them to the lab, specific departments, or to a doctor's office. Occasionally, it may involve speaking on behalf of the patient, especially when the interpreter perceives that the patient is being treated unfairly. This aspect of advocacy can be controversial, so it's critical to always follow the Medical Interpreter Code of Ethics and Standards of Practice for medical interpreters when deciding how to act. By understanding and practicing these roles, Conduit, Clarifier, Cultural Broker, and Advocate, you will help ensure that patients receive the best possible care and that providers can communicate effectively. I hope you now have a clearer picture of the knowledge, skills, and abilities that medical interpreters need, as well as the vital role they play in healthcare. If you found this video helpful, please take a moment to like it, share it with your colleagues or classmates, and subscribe to our channel so you don't miss future lessons. And if you're interested in becoming a medical interpreter or improving your own knowledge, skills, and abilities, as medical interpreter, please visit our websites at www.interpretersacademyofjax.com and smeonlineclasses.com for more information about training and how we can help you to prepare for certification opportunities. We look forward to supporting you on your journey as a professional medical interpreter. Please let us know in the comments below what kind of training do you need, and how can we help you in pursuing academic and career goals. Thank you for joining us for this introduction to medical interpreting, and please remember to share your comments below, like our video, and subscribe to our channel to be able to receive more videos like this. Until next time.